When a person is infected by HIV, the body responds by producing antibodies. However, the protection of these antibodies is not strong enough. HIV antibody test detects the presence of such antibodies in blood or oral fluid. It can tell whether a person has been infected with HIV. If the test result is positive, it means that the person is HIV infected. If the test is done after the window period and the result is negative, it means that the person is not infected. Venous blood sampling is a conventional HIV test. It takes around 1 week for the result, whereas rapid tests, such as finger prick, blood, or oral fluid, only require 20 minutes. Rapid test is only a screening test. Any positive result should be followed by taking venous blood for a confirmatory test conducted by a laboratory. HIV antibodies take some time to develop in the human body before reaching a detectable level. The period between initial infection with HIV and when the antibody test shows a positive test result is called the window period. Subject to individual conditions, the window period can be up to 3 months. A negative result obtained during the window period cannot exclude HIV infection, as it may be due to insufficient levels of antibodies to be detected. During this period, the virus replicates rapidly in the infected person, who becomes highly infectious, and can transmit the virus to others even if a negative result is obtained. Users should retest after the window period or consult a doctor whenever in doubt. Most HIV-infected persons are asymptomatic during the early phase of infection. If a person has been sexually active and has never been tested before, he or she should consider performing HIV testing. If a person has multiple sex partners or persistent unsafe sexual behaviors, he or she should perform HIV testing every 6 to 12 months regularly. Although there is as of yet no cure for HIV infection, medications are available and effective in fighting HIV and its complications. Antiretroviral agents attack HIV at different stages of its life cycle to inhibit HIV replication. Effective antiretroviral therapy can reduce the number of viruses in human blood and increase the number of CD4 cells, which helps maintain the immune system, as well as contribute to fewer opportunistic infections and HIV-associated cancers. With the right way in taking the therapy for around or within 6 months, most of them could achieve undetectable viral load by standard laboratory tests. Evidence has shown that people with HIV who achieve sustained viral suppression to an undetectable level by antiretroviral drugs have no chance of passing on the virus through sex.